Tonight, heat waves drive more ER visits for chronic disease. Controlled breathing may help cut addiction cravings. U.S. mental health treatment rates rise, but gaps persist. Self-sampling can be feasible for respiratory infections. Metabolic syndrome tied to increased CRC risk in young men. Pregnancy weight gain. Hypertension tied to JIA risk in kids. Popular opioids may not relieve breathlessness in COPD. Healthy grocery delivery curbs blood sugar levels in T to D. GLP-1s work better after bariatric surgery, and encephalitis linked to long-term dementia risk. We start with heat waves drive more ER visits for chronic disease. Heat waves drive more ER visits for chronic disease. In some parts of Spain, there have already been 5 heat waves so far this summer. The clear impact of climate change on the intensity of hot summers is evident in the activity at emergency rooms. Cristóbal Rodríguez-Leal, MD, physician in the Emergency Medicine Service, Hospital Universitario del Henares, Coslada, Spain, warned that prolonged heat waves are changing the profile of patients arriving at emergency departments and calls for adapting the healthcare system to a climate reality that is no longer what it was 20 years ago. The increasingly frequent and intense heat waves no longer result solely in an increase in heat stroke or dehydration cases. They are also quietly changing the profile of patients arriving at emergency departments, with a rise in exacerbations of chronic diseases, especially among the elderly and other vulnerable groups, he explained to El Médico Interactivo, part of the Medscape professional network. We're seeing heat-related emergencies that were exceptional 20 years ago, such as classic heat stroke or exercise-induced heat stroke. But that's just the tip of the iceberg, he added. In the internist's view, the real problem isn't just the most tricky. Controlled breathing may help cut addiction cravings. TOPLINE controlled breathing interventions, including heart rate variability biofeedback, HRVBF, were associated with reduced craving in patients with substance use disorders, SUDs, compared with control interventions, a new meta-analysis showed. However, their effects on withdrawal symptoms were uncertain, and evidence regarding their effects on dependence was limited. Methodology: researchers conducted a systematic review and meta-analysis, with the former including 20 randomized and non-randomized controlled trials and crossover studies, identified through 8 databases up to November 14, 2025. 5 uncontrolled studies were excluded from the meta-analysis. Individuals with SUDs involving alcohol, nicotine, and/or other psychoactive substances were included. Resonant breathing, HRVBF, yogic breathing, and other interventions with controlled breathing as the primary therapeutic mechanism were examined. Comparators included active and passive control interventions. Outcome measures included craving 12 studies, N equals 696, withdrawal symptoms 4 studies, N equals 289, and dependence 2 studies, N equals 144. Takeaway: breathing-based interventions were associated with lower CR. U.S. mental health treatment rates rise, but gaps persist. TOPLINE, the rate of any form of treatment for psychiatric disorders in U.S. adults, was 61% in 2020-2022, but only 34% of patients received minimally adequate care, new research showed. Additionally, disparities persisted, especially for non-Hispanic Black and Hispanic individuals, men, and adults aged 45-65 years, and greater symptom severity was linked to higher treatment rates. Methodology: the Mental and Substance Use Disorders Prevalence Study used clinician-administered clinical interviews to collect data from 4764 adults aged 18-65 years, 51.1% women, 59.7% non-Hispanic white individuals, selected from a household sample of the U.S. population between 2020 and 2022. Psychiatric disorders diagnosed in the study included lifetime and past-year schizophrenia spectrum disorders as well as past-year major depressive disorder, MDD, generalized anxiety disorder, bipolar I disorder, post-traumatic stress disorder, obsessive-compulsive disorder, anorexia nervosa, and substance use disorders. Any treatment was defined as at least one inpatient or outpatient visit or the use of psychiatric medications in the past year. Disorder-specific minimally adequate treatment was defined on T. Self-sampling can be feasible for respiratory infections. TOPLINE, in a pilot study of 108 Swiss households, participants self-collected samples during respiratory illness. Valid results were obtained for 70% of expected human samples and 51% of pet samples, supporting the feasibility of remote household-based surveillance for respiratory infections. Methodology: researchers conducted a pilot study to evaluate whether household members could collect their own respiratory samples for testing, and whether online symptom questionnaires plus telemedicine could support decentralized surveillance. They enrolled 108 households, including 161 adults, 32 children, 29 cats, and 15 dogs, in Switzerland from May to September 2023. The first household member to develop new respiratory symptoms, sore throat, runny or stuffy nose, cough, or shortness of breath, for at least 24 hours collected a nasal swab as the index case. Other members collected swabs 7 days later. All samples were mailed to a central biobank. Samples were tested using a multiplex polymerase chain reaction panel for 13 common respiratory viruses, including SARS-CoV-2, influenza A and B, human rhinovirus, human respiratory syncytial virus, human metapneumovirus, and human parainfl. Metabolic syndrome tied to increased CRC risk in young men. TOPLINE metabolic syndrome, METES, was associated with a higher risk for colorectal cancer, CRC, in men younger than 60 years, but no significant association was observed in women of the same age group. Elevated waist circumference was the sole METES component consistently linked to a higher risk across most demographic groups. Methodology: researchers analyzed data of 379,173 UK biobank participants aged 40-69 years who were recruited between 2006 and 2010 across England, Scotland, and Wales. Participants were stratified into 4 groups on the basis of sex and the age cutoff of 60 years. Younger men, age 60 years. Older men, age greater or equal to 60 years. Younger women, age 60 years, and older women, age greater or equal to 60 years. METES was defined according to the established criteria, requiring at least 3 of the following 5 metabolic abnormalities. Elevated waist circumference, greater or equal to 102 cm in men and greater or equal to 88 cm in women. Hypertriglyceridemia, greater or equal to 1.7 mmol/L. Hyperglycemia, A1C levels greater or equal to 42 mmol/mol or antidiabetic medication use. Elevated blood pressure, systolic blood pressure greater or equal to 130 Hg. Diastolic blood pressure greater or equal to 85 Hg or antihypertensive medication use, and low high-density lipoprotein. Pregnancy weight gain, hypertension tied to JIA risk in kids. TOPLINE children born to mothers with higher gestational weight gain or hypertensive disorders of pregnancy had an increased risk for juvenile idiopathic arthritis, JIA. Maternal prepregnancy BMI was not associated with an overall risk for JIA. However, genetic susceptibility appeared to modify the association between maternal BMI and the risk for JIA. Methodology: researchers analyzed data from a prospective Norwegian cohort, MOBA, to evaluate whether maternal and perinatal characteristics including prepregnancy BMI, gestational weight gain, hypertensive disorders of pregnancy, and birth weight were associated with the risk for JIA in offspring. They included 78,901 singleton children and captured JIA diagnoses between 2008 and 2023. 265 children, 61% girls, had JIA. All children were at least 14 years old, and 85% were at least 16 years old at follow-up. The researchers also assessed whether hypertension or birth weight mediated the association between gestational weight gain and JIA. Interactions between maternal exposures and a JIA polygenic risk score were evaluated in a genotyped subgroup of 44,245 children, including 192 with JIA. Takeaway: each 1 SD increase in GEST. Popular opioids may not relieve breathlessness in COPD. TOPLINE in patients with stable chronic obstructive pulmonary disease, COPD, and persistent breathlessness. Low-dose transdermal fentanyl and low-dose sustained-release oral morphine did not reduce daily breathlessness or improve related outcomes compared with placebo. Methodology: researchers conducted a randomized double-blind crossover trial across 10 hospitals in the Netherlands to assess whether low-dose transdermal fentanyl or sustained-release oral morphine reduced persistent dyspnea in patients with stable COPD. A total of 58 participants with stable COPD and persistent dyspnea despite optimal care were enrolled between 2019 and 2024. The mean age of patients was 69 years, 54% were women, and mean forced expiratory volume in 1 second was 33% predicted. Each patient received transdermal fentanyl 12 microg/H, sustained-release oral morphine 10 mg twice daily, and placebo in random order, each for 11 days with a 3-day washout between periods. The primary outcome was a change in mean daily breathlessness measured on a scale of 0-10. Secondary outcomes included worse daily dyspnea, health status, anxiety, sleep quality, and capillary blood gas parameters. Takeaway ATOT. Healthy grocery delivery curbs blood sugar levels in T2D home delivery of healthy groceries for 6 months, significantly improved blood sugar levels among individuals with type 2 diabetes, T2D, independent of any changes in medication, results of a new study showed. Medically tailored groceries have generated tremendous interest among health systems, policymakers, and payers as a way to address food insecurity and support chronic disease management, said lead author Claudia Now, Ph.D., a researcher with the Kaiser Permanente Southern California Department of Research and Evaluation. The idea is intuitive, she added. If we want patients to manage conditions like diabetes, it's important not only to prescribe medications, but also to ensure they have access to healthy foods, she said. The findings of the study were published in Circulation. Although food is medicine initiatives are emerging as ways to address these barriers, data on their effectiveness are limited, the researchers noted. Now and colleagues enrolled 460 Medicaid-insured adults in Southern California with T2D between November 2021 and July 2022. Participants had elevated A1C based on at least 2 measurements greater or equal to 7.5% in the past year. The mean age of the participants was 59.2. GLP-1s work better after bariatric surgery. TOPLINE in a large real-world study of adults with obesity who underwent metabolic bariatric surgery. Those who began taking a GLP-1 either before or after surgery had lower all-cause mortality than those who underwent surgery alone. Starting GLP-1 therapy after surgery was associated with fewer cardiovascular events, micronutrient deficiencies, and post-operative complications. Methodology: GLP-1s improve weight loss and glycemic control in patients who respond poorly to metabolic bariatric surgery alone. However, the optimal time to start these drugs before or after surgery remains unclear. Researchers conducted a retrospective cohort study using real-world data of adults with obesity who underwent metabolic bariatric surgery by comparing 3 approaches: starting a GLP-1 at least 1 month after surgery, requiring 3 or more consecutive prescriptions; starting a GLP-1 at least 3 months before surgery, requiring 3 or more consecutive prescriptions; and surgery alone with no GLP-1 use. After propensity score matching, 3 comparison cohorts were created. GLP-1 after surgery versus surgery only N equals 20,066 per group. GLP-1 before surgery versus surgery only N equals 14,330 p. Encephalitis linked to long-term dementia risk. TOPLINE patients who survived encephalitis had an increased risk of developing dementia and related diagnoses compared with matched control individuals, with the association persisting across all age groups and varying by encephalitis subtype. Older adults, 60 years, showed elevated risk across all dementia categories, while younger cohorts, 40 years, exhibited increased risk primarily for other degenerative diseases of the nervous system. Methodology: researchers conducted a retrospective cohort study using electronic health records from the TriNet ex-US collaborative network. A total of 53,379 patients diagnosed with encephalitis between January 2005 and June 2026 were included and stratified by age into 4 groups: 20 years, 20-40 years, 40-60 years, and 60 years. Each encephalitis cohort was compared with age-stratified control cohorts, patients presenting for general health examination without encephalitis diagnosis. Using one propensity score matching based on demographics and comorbidities including diabetes mellitus, hypertensive diseases, heart diseases, chronic kidney disease, and cerebral infarction. The primary outcome was dementia and related diagnoses defined. That's all for this news briefing. Thanks for listening. Also, don't forget to hit the subscribe button.